the symposium approached, I thought that one word that would come up a great deal is trust. And sure enough, it has. So the question I pondered was, how do we build trust? In thinking about what builds trust in my career thus far, working with consumers and researching consumer behavior, the one theme that emerges again and again is that consumers want transparency. More and more consumers have a growing awareness about how their food is grown, how it is produced, and what practices are employed in that production. This covers the gamut from environmental concerns to worker rights to animal welfare and antibiotic use. In my doctoral studies, I would never cite Wikipedia, but for trying to capture the public's lexicon, it can be helpful. Transparency, as used in science, engineering, business, the humanities, and in social context more generally, implies openness, communication, and accountability. Transparency is operating in such a way that it is easy for others to see what actions are performed. It has been defined simply as the perceived quality of intentionally shared information from a sender. For example, a cashier making change after a point of sale by offering a record of items purchased or a receipt as counting out the consumer's change on the counter demonstrates transparency. I find it interesting that offering a record is used in this definition. Record keeping is a key part of understanding transparency, and I would argue that it is also what builds trust. So record keeping applies to those of us in this room. Consumers keep records through receipts, and they can help Rob Tokes and his teams at CDC trace outbreaks to their source. FDA keeps records of approved pharmaceutical label claims. USDA keeps records of residue violations. And I just betcha, hiding behind the proprietary curtain of the food industry, there are numerous records relating to production practices, including antibiotic use by species and administration. Until industry pulls back that curtain, consumers are left in the dark, uncertain of what to buy, uncertain of what is safe, and they make the best decisions that they can with the limited knowledge that they have. As for definitions, I tend to think of antibiotic stewardship as being equal to the last line of defense, only used as a last resort when absolutely necessary, meaning that there are no other options and all other resources have been exhausted. Thus, preventing infections is also as important and a part of this, as Dr. Solomon pointed out earlier. Not only our health, but the health of animals is at stake if we don't take this approach. Curing an infection is only possible when the bacteria are susceptible to therapy. Transparency works, and this is an example. Or at least Purdue believes that transparency works with this recent announcement. Purdue Foods is removing all antibiotics from its chicken hatcheries. Jim Purdue made the announcement at a press conference recently. Eliminating antibiotics from its hatcheries, he said his company has reached the point where 95% of its chickens never receive human antibiotics. And for the chicks that do need medical attention, it's only in situations where a veterinarian has prescribed the medication and only for a matter of days. Purdue said the decision, which exceeds the voluntary standards set by FDA, was born from consumer concern. It wasn't easy, but we found along the way that we can raise healthy chickens without antibiotics, Jim Purdue said. The press response was overwhelmingly positive. And when the press came to us, we applauded the efforts loudly. However, consumer groups also asked the company for even more transparency in a letter that we sent to the company. Here's an excerpt of that letter. Your policy of limiting the use of medically important antibiotics to disease treatment and control in flocks with sick birds has long been recommended by the public health advocates. Your decision to eliminate the use of antibiotics in your hatcheries is particularly important, as antibiotic use there has been clearly linked to resistance in both the treated birds and in sick humans. The implementation of these policies means that less than 5% of the chickens produced by Purdue are ever administered medically important antibiotics. These substantial reductions in antibiotic use are important not only in and of themselves, but also because they demonstrate that chicken can be produced without the extensive use of antibiotics. We encourage you to take a leadership role in your industry and share your experiences with other poultry producers so that the poultry industry as a whole can move forward to more responsible use of antibiotics. We also ask that you share more detailed information with the public on the amount of antibiotics you use, or alternatively, share this information with the United States Department of Food and the United States Food and Drug Administration. Scientists and policymakers need more information on how antibiotics are used on farm to better understand the role of food-producing animals and the spread of antibiotic resistance. Purdue Farms, as a leader in the responsible use of antibiotics, could play an important role in closing this information gap. This is just one example of how we're asking for better metrics from industry. And according to a press release just yesterday, we're not the only group that thinks transparency is a good idea when it comes to data collection on the distribution and use of medically important antibiotics used in agriculture. Senators Warren, Gillibrand, Feinstein, and Harkin now are asking for transparency from the FDA. They are asking for an increase in data collection on the distribution of medically important antibiotics used in agriculture and to develop a plan to estimate on-farm antibiotic use metrics. So the ultimate metric of success is seeing a reduction in human illnesses. So how do we get to this metric? How do we measure this? Well, first of all, if you use this as a model for how humans can get sick from food animals, you want to start with a drug class, and you want to start by importance, and that's where stewardship comes in. You can use the WHO list, the OIE list, Guidance for Industry 152, but knowing drug class is very important as a metric. And then dose and duration, administration, and the purpose of that administration, as well as species and point in production. The resistance profile at the point of purchase and at slaughter and consumption is also important, as well as a resistance profile in humans. All of these are important metrics that will get us to, hopefully, reducing illness in humans. So how do we get reduction in human illnesses? We get it by better understanding the whole of resistance, the pathways, and the risks. NIAA has a number of grants out, and we encourage USDA to outline what and how they will disseminate the information gained from that funded research and how they plan to enact policy based on the grant-funded findings. We also have asked the executive branch recently to also look at some policies there as well. So strengthening Guidance 213 so that the FDA can eliminate wanton uses of antibiotics for disease prevention. Upholding existing federal standards that ensure meaningful veterinary oversight of antibiotic use, and restricting pharmaceutical marketing claims that emphasize the growth-promoting benefits of prevention antibiotics. For the sake of time, I'm going to skip over this slide just before. This is an example and an illustration of just how difficult it is to tell a success story. So if you take nothing from my talk today, let it be this. We're not going to have success stories to tell if we don't continue in a spirit of transparency, trust, and urgent timing. This is something seen recently in the Metro of DC. I'm not sure about anyone in this audience, but personally, I don't think that misinformed marketing particularly aids in consumer choice, nor does it help the cause to reduce overall antibiotic-resistant pathogens that emerge from our food supply. Marketing such as this is never beneficial. Let's all make the commitment to act more as a team, to be more transparent and help conquer everything from advertising that stretches the First Amendment to the point of weakening it, to misinformed marketing that leaves the consumer afraid of their food, and remember that we're all on the same page. No one wants to contract a multi-drug resistant foodborne infection. We're all called to be stewards of antibiotics, all of us. Thank you.